Hello, my name is Reggie Chapman. I use he, him pronouns. I am the Director of Policy at the Fortune Society's David Rothenberg Center for Public Policy. Welcome to Both Sides of the Bars, which is a discussion-driven show that examines the criminal legal system from various perspectives, including people most impacted by the system. Here we discuss critical questions about how the criminal legal system works and its intersections with social justice and the efforts that advocates are making to improve the lives of everyone affected. We ask that you, the viewers, spread the word about both sides of the bars and share your comments with us on Twitter, also known as X, at the Fortune SOC. Today's show is titled Public Health Issues in the Black Community and Their Effects on People Directly and Indirectly Impacted by the Criminal Legal System. Our guest for today's show is Dr. Robert Fullilove. Dr. Fullilove is a professor of social, medical, and clinical sciences and associate dean for the community and minority affairs at Columbia University's Melman School of Public Health. He also teaches public health at several New York State prisons via the Bard College Prison Initiative and serves as a senior advisor to BPI's public health program. Some of Dr. Fullilove's interests include urban health, HIV and AIDS, substance use disorders, and mass incarceration. From 1995 to 2001, he served on the Board of Health Promotion and Disease Prevention at the National Academy of Sciences Institute of Medicine. Since 1996, he has served on 5 medicine study committees that have produced reports on topics including substance use, addiction, HIV and AIDS, and health. In 2000, Dr. Fullilove became a committee co-chair for the CDC's HIV and STD Prevention Advisory Committee, and in 2003, the National Academies of Sciences designated him as a National Associate. In addition, between 2007 and 2004 and 2007, Dr. Fullilove served on the National Institute of Health's National Advisory Council for the National Center of Complementary and Alternative Medicine. In addition, Columbia University's Melman School of Public Health also awarded Dr. Fullilove the Distinguished Teacher Award 3 times. During this episode, Dr. Fullilove will discuss the intersections between public health issues that disproportionately impact the Black community and the community's criminal legal system involvement. He will also propose some solutions to address these public health crises and discuss what we can expect going forward in the future. So let's begin. Good afternoon, Dr. Fullilove. We're honored to have you here on both sides of the bars. As your resume demonstrates, you have an extensive history in public health work and community engagement, and you have been a pillar in the community for decades. And so we look forward from learning a lot from you here today. So Dr. Fullilove. Thank you. So Dr. Fullilove, research suggests that public health issues that persist in the Black community have direct and indirect effects on the population's criminal legal system involvement. Public health researchers in particular think of this phenomenon in the context of the social determinants of health. In light of such, we would like for you to define a few terms for our audience. So the first term we would like for you to define for us is, what exactly is public health, Dr. Fullilove?
That is a very good question, because I think it's an issue that the general public often really struggles to define. So let's say that public health is the collection, the ensemble, if you will, of all the efforts undertaken by society, largely managed by government, to promote health and prevent disease. This means managing a health crisis of the type we just underwent with COVID-19, but it also means managing the affairs that govern how access to medical care, how outcomes of medical research and medical practice are going to impact the general public. These are all things that are under the general term that we utilize when we talk about public health. And the big issue, of course, is how does that affect the kinds of issues that we're going to be discussing today. So let me just say that more than anything else, what concerns public health are all of those sets of conditions, those that are in society and those that exist in the environment, that might have a positive or a very negative effect on health. And to the degree that mass incarceration is a social action that impacts a lot of individuals and a lot of communities, it naturally comes under the purview of what we in public health are interested in studying.
Thank you, Dr. Fullilove. You said a lot in that, and so some of the things you mentioned are mass incarceration and several other things, and we'll kind of get to those questions throughout this conversation. Thank you, Dr. Fullilove. And so my next question for you is that, can you define for us what exactly are the social determinants of health?
Well, let's think about health in general, because it's a term that people use all the time, but that they often struggle to define. For the average individual, health is the absence of disease. But those of us in
Mm.
medicine and public health are aware that it is much, much more. It's all the things that promote wellness, optimal functioning of the body, optimal functioning of the mind, a sense of wellness, if you will, a belief that if you're in the world, you're there as someone who is able to act, to do, and to behave in a way that promotes your own health as well as that of the folk who are around you. Now, whenever we think about health as disease, the first place we go is to the body. After all, it's the body that gets sick. But we're aware of the fact that some of the illnesses that besiege us are illnesses that come not from some malfunction of the body, at least not completely. In many instances, what we're looking at is the impact of our social environment, the impact
Mm.
that occurs when we interact with other people. And the nature of our engagement in political and social structures can also create exposures that have a direct impact on health. Mass incarceration would be an example. What happens to the body when it is taken out of a familiar setting and put behind bars? The idea that it would have health consequences, I think, is almost self evident. And it's one of the reasons why, when we think of the social determinants of health, we think about the impact of social settings and social situations like being behind bars, being incarcerated, and wonder how much and to what degree we're looking not only at impacts that will affect the individual's health, we're also looking at the community's health as well. What happens when large numbers of individuals are taken out of communities, taken out of neighborhoods, and the functioning of the community, the functioning of the neighborhood is also going to be affected. We know that one of the effects that will be most likely observed are effects on the general health of everybody when substantial numbers of adults who should be about the business of making sure that the community functions well are no longer there. These are all the kinds of things that we study when we look at mass incarceration as a public health phenomenon that has a direct and perhaps measurable impact on the health of people who are in impacted communities.
Great, great, great. That was amazing, Dr. Fullilove. You kind of created a great segue, a great situation to allow us to segue into our, second round of questions. And so I want to kind of talk to you about like the social dynamics of disease and association with criminal legal system involvement. And you kind of already gotten us there. And so, and you also spoke about the first question that I actually want to speak about under that header, which is that, do you think that mass incarceration itself actually increases disease within the Black community?
It certainly weakens communities where, once again,
Mm.
large numbers of adults are no longer present. The most visible impact are often on the young. Children who are raised without a parent who's perhaps doing time in a carceral setting, are going to be deprived of the natural resources that promote health and prevent disease in kids. So, if for no other reason alone, the fact that you are taking a community resource and putting it someplace else where it is no longer accessible to, no longer able to be utilized by folk who are in that community, yeah, we are very clear that that kind of absence, that kind of withdrawal of a community resource definitely will impact normal social functionings, and they will also indirectly and directly impact normal health functions as well. So, yeah, we are very interested in what happens when folk go away for a long period of time and are absent from their families, when they return after a long period away and they struggle to readjust, when perhaps the things that took them off the street are things that once they return are now going to be a problem for all those around us. Those are the kinds of things that we know are an appropriate area for us to focus on and an appropriate way for us to study how the social impacts of health connected to mass incarceration impact the health of those in our communities.
Great, great. This is amazing, Dr. Fullilove. I was going to my next question about what can citizens and activists, which they focus on, and you kind of already answered that question. So thanks a lot for that. And being with that said, I'd like to go on to our next topic, which is essentially, substance use and criminal legal system involvement. So again, you've done, as your bio says, you've done a considerable amount of work in this area. And so my first question for you is that, how do the social dynamics work in reference to substance abuse and its association with Black communities' criminal legal system involvement? Can you highlight your work in this regard and its importance to the field?
I certainly can. My work in the 1980s with HIV/AIDS began with a study of the impact of crack cocaine on HIV infections in the Black community. A number of things became immediately apparent. Number one, we were dealing with a harmful substance that had the capacity to create substance use disorders, addictions. Number two, we were very clear that some of those addictions were basically a function of folk engaging in the kinds of behaviors that would give them access, easy access to the substance of choice. And in some instances, the actions that they took, sex work, robbery, engaging in violence, all had public health consequences that concerned us significantly. So, in addition to having a harmful substance that had as its presence in the community a real possibility for creating a great deal of harm, we also had the public reactions to the presence of this substance in community life. We decided that while it was a public health medical crisis, that there were so many people impacted by this drug, our decision as a nation in the 1970s was bound up in the actions of the President of the United States, Richard Nixon, to essentially declare a war on drugs. So instead of treating the problem directly by providing resources to help folk get into recovery so that their substance use would not continue to be a social problem for them or society, we decided as a nation to criminalize it, to make its management the province of the cops, the courts, and for all intents and purposes, our carceral settings, jails and prisons. That meant that we created a problem that has had ongoing consequences. Number one, it did not reduce the desire, the demand, if you will, on the part of members of the general public to get access to drugs. Our criminalizing this behavior, locking large numbers of people up, not only did not solve the problem, it actually created problems by turning individual citizens who'd been caught up in the carceral system into folk who are now going to forever live with the consequences of having been labeled a felon. No longer able to vote in some states, no longer able to access housing or jobs or medical care. They now become a burden on the society. If they are returned back to the communities, their difficulties in finding work, their difficulties in finding access to health care represent a burden on the community that is at least as problematic, if not more so, than the problems that we hope were going to be solved by having a war on drugs. So the idea that we have, as a nation, reacted to it unsuccessfully, the fact that as a consequence of this war on drugs, our desire to limit the problems that are created by substance use, meant that we created a massive problem with so many people caught up in carceral settings that their inability to function as regular citizens now represents in some communities a serious burden on the services that are provided to help people survive. All these things, it seems to me, are obvious political, social, and economic consequences of mass incarceration. And the notion that this move towards mass incarceration was started by a public health crisis is one of the larger ironies I think I've been living with for all the years that I've been doing research and community activity in the public health sphere. So the idea that what we're looking at is a problem that was intended to be solved, but instead created a problem that was much larger, is one of the real issues that I think we in public health are faced with at this point in the year 2025.
Wow. Dr. Fullilove, that was amazing recount of history and just weaving in all the various webs of significance that play a part in this phenomenon. And you said a lot in there, but you also said something that I want to ask you about. So you kind of basically summarized it by saying that this was like this idea of like substance abuse and crime was legislated. And so that leads me to a question which I want to ask you. Is substance abuse disorder more prevalent in the Black community, or is it a matter of policing in those spaces?
I think it's very clearly a matter of policing in those spaces. Year after year, the National Institutes of Health and the National Institutes, what am I trying to say? The National Institutes of Drug Abuse, NIDA, have been a part of a series of studies that have looked at the prevalence and incidence of drug use in communities throughout the United States. What they discover is that folk in the Black community, the folk in the Hispanic community are no more likely than folk in the white community to be involved in, for example, using drugs like marijuana, cocaine, or heroin. What sets these communities apart are the consequences they face as a result of having engaged in these activities. The criminal consequences of engaging in drug use of an illicit substance have clearly fallen way more heavily on Black and brown communities than they have on white communities. So, what we're looking at is now a difference in the rate or the types or the kinds of drugs that people use. What we're looking at are different impacts of drug use on the communities of folk who are involved in this kind of behavior.
Great, great, great. Thank you for that response, Dr. Fullilove. My next question is, what drugs, illegal or illegal, based on your research, have had the most devastating impact on the Black community, if that is a thing?
Yeah, I mean, it's very hard to categorize because part of what we'd have to do is define, well, what do you mean by harm? What's been the nature of the hurt? Let me just say that,
Right.
having said that, from my own experience, the most problematic drug is the one that's legal, alcohol, or the other problematic legal drug, nicotine. Tobacco use is still a major problem in our community. And God knows the domestic violence rates that have as their core somebody being inebriated, somebody drinking too much, are really off the charts. So if I think about the consequences of the human tendency to basically look for substances that allow them to get high, the most problematic of those substances from a public health point of view have to be those that are associated with tobacco use and those that are associated with alcohol use. If you simply look at the alcohol related fatalities on the highway, which we number every year in the tens of thousands, no damage done by cocaine, heroin, or other illicit substances combined will come even close.
Wow, that's amazing. It kind of makes me think about going back to what you said earlier when you described the social determinants of health and one's propensity to use legal or illegal substances. And that's a perfect way for me to segue to my next question under this header, which is that, do you think that this is associated with the Black community's mental health crisis as well? By that I mean it meaning substance abuse and substance use.
Yes, I do. Mindy Fullilove, who has for 40 years now been the leader of the research group that I proudly identify as my own, early on in her studies of crack cocaine noted that in drug treatment programs where we did the bulk of our work, we were engaging with folk who were not thrill seekers. In too many instances, folk were using their substance to medicate an undiagnosed mental health issue, typically depression or post traumatic stress disorder. To the degree that this was the treatment that was available at the cheapest price, it again underscores how much of what we look at when we look at the war on drugs has been a war that has partially been waged on folk who are struggling with mental health issues, not necessarily folk who are bent on disobeying the law. So, yes, I think that it's really important that we underscore how much what we're looking at isn't simply the adolescent desire to escape reality. In many, many, many instances, people who are drinking, people who are smoking, people who are injecting stuff are doing so in part because they're combating some kind of poorly treated, often undiagnosed mental health difficulty. And the more we're able to do the job as a society of being able to balance how we approach folk who are struggling with mental health issues, the greater the likelihood that we'll have a lot of solutions to the problems that we right now put under the heading, put under the rubric of substance use disorders.
So you again, you've been great at providing me with the segue to the next set of questions. And so my question for you, doctor, is that, so I know it's a lot. You said a lot, and I don't think there's a magic bullet, no pun intended, or a magic pill to remedy these issues. But what do you think that advocates and concerned citizens could do to at least try to like address these issues?
I think there are a couple of things. Number one, maybe the easiest and the one that is less subject to controversy is a real push on the part of citizens to make sure that mental health services are appropriately available, that they're not a part of medicine where the quality of the service you get depends on how much money you have. If we're clear that we are struggling as a society with a wide variety of mental health issues and problems, think about the series of Surgeon General's reports we've had over the course of the last 2 years. Then let's be clear that we owe it to ourselves as citizens to put pressure on our lawmakers to assure that they don't brush aside problems that really do require a hard, cold look at meeting the mental health needs of society and then providing society with the resources to respond to those needs. That's the first and foremost thing. Second thing is, it's very clear that part of what we struggle with the issue of mass incarceration has everything to do with how much money we spend on issues of social control. We over police some neighborhoods out of a belief that the more police there are, the better the level of behavior we're going to have on the part of the general citizen. When I think the most important result of over policing is a lot of cops make a lot of arrests and as a consequence send a lot of our neighbors to jails and to prison, where as a result of perhaps being convicted of a felony, they now become second class citizens who are going to struggle that much harder to overcome the limitations that are going to be imposed on them as formerly incarcerated individuals. So, to the degree that we are concerned about focusing our time, our energy, and our city's resources on doing the kind of policing that isn't just about locking people up and throwing them behind bars, to the degree that we really are concerned about public safety and engaging with the normal citizen on the street as partners in helping assure that public safety is possible, rethinking our notion about policing not being about locking people up, but assuring public safety. Those were all things that I think a concerned citizen who was trying to get the best out of elected officials, those are the things that I think we're in a unique position to do. And I think as the head of policy for an important organization like the Fortune Society, I think your focus on roles like this, making sure that people are aware of the fact that there are problems that we as citizens are in a position to address, I think that's also a service that you provide. And it's one that I think has to be continued. Community awareness
Thank
is
you.
really important for action.
Thank you for your advice, and I thank you for your encouragement, Doc. And I think that's something that we will consider, we do consider. And so, just hearing you give me that advice and giving Fortune that advice is worth something. Thank you. So, I want to go to my next question. Concerns violence as a public health issue. So, my question for you, Doc, is how can society benefit from viewing violence as a public health issue as opposed to a criminal justice issue?
Yeah. Uh, by understanding that when we have a violent act, we're already kind of too late. One of the most important priorities in public health is prevention. So, what are the things that we know are in the best position to prevent violence? In the United States right now, what scares us to death, or at least what should scare us to death, is the fact that we're a nation that has more guns than citizens. The simple fact that we have the tools of violence ready to hand, that there are so many states that are passing laws that suggest you don't have to have a license to carry a weapon. The belief, for example, that if more people are armed, that will act as a deterrent to violence. The data are in, it doesn't work that way. As a consequence, the idea again that we are in a setting where violence is more likely to be problematic than it is in any other industrialized nation on the planet is made that much more problematic here in the United States because of our access to guns. I would say, of all the things that we're in a position to do, of all the things that are potentially doable, working to limit access to firearms and working to limit the damage that gets done with them is one of the most important ways we can think about violence. The second is to focus back again on the question you raised very appropriately about mental health. How much of what we're looking at in violent reactions to individuals or to situations really represents an underlying mental health problem that has gone untreated, unrecognized, and as a consequence, something that's likely to explode at any moment and create all kinds of problems for all who are concerned. Once again, I think we pay too little attention as a nation to devoting time, energy, and resources to caring for the mental health of the American citizenry. And to the degree that violence often stems from these unresolved mental health crises, of all the things that we're in a position to do, being aware that we could treat these problems, that we should treat these problems, and that we should make the resources available to make treatment possible, those are all things that I think we're in a unique position to do. And they're certainly the recommendations I would make for anybody who wants to move forward on these issues and make a difference.
Thank you, Doc. Thank you, Doc. And you said so many things in there that are appropriate, that are profound. I guess one thing I thought about in response to what you said was that this idea of having access to guns, and I don't have a magic pill to address these issues, but one thing I can say in my own research, because I am an MPH in epidemiology and health policy and practice, which is that I'm old enough to have been in these communities before we had a massive amount of guns in these communities, and they were different. And I've been in these communities when we see a massive amount of guns, and I see the increase in violent crimes. And one thing I can say is that I don't know what the society will be specifically, but what I do know is that if we take out the guns and we reduce people's access to guns, then this world and the communities in which we live in will definitely be a better place.
I think more than anything else, the idea that we might as a nation start rethinking the role of government.
Thank you to Dr. Fullilove for sharing your wisdom. Thank you to the viewers for listening to our thought-provoking discussion. On behalf of the Fortune Society, we want to thank you for tuning in to Both Sides of the Bars. If you're interested in finding out more about the Fortune Society, please check us out on the web at fortunesociety.org. That's fortunesociety.org, or on Facebook by typing in the Fortune Society. This is Reggie Chapman, and I appreciate you for joining us for critically looking at both sides of the bars. Thank you.